jump into our second topic of health, which is an essential component of quality of life and the things that make the community work. And so we're going to change it a little bit differently on this panel. We're going to give them each a question, and they have that question on their own. And so we're going to, but before we jump into that, I'm going to ask, starting with Dr. Jackson on the end, to introduce yourself very briefly, say who you are, and so everybody can know each of you.
Good morning, my name is Jennifer Jackson. I have my own nutrition consulting business. It's called Keystone Nutrition. I have no competition because I work at the places where most dietitians wouldn't want to work. I'm at 10 parish correctional centers, which is the jail. I'm also at 2 juvenile detention homes throughout the state. I'm also at WIC. WIC is a low-income supplemental food program for women who are pregnant, their infants and children, and I also work at LARC. It's for people with developmental disabilities.
Good morning. I'm Gary. I'm the social worker for Smile Community Action here in Lafayette and St. Martin, Liberia. I provide crisis services, mobile assessments, evaluations, linking referrals, so anything mental health or referring, that's what I do. I've been a social worker for 30 years. All of my clients for the last 30 years have been either disabled, impoverished, or living on disability. So I have the advantage of being able to focus on social justice at this stage of my life, and I'm really having a great time doing it. Thank you.
Good morning, I'm Dr. Tina Stefanski. I'm the Regional Medical Director and Administrator for the Office of Public Health in this Acadiana 7 Parish region. I'm a pediatrician by training and have been working with Office of Public Health for the last 15 years. And I recruited with me on this panel because I think she's got some information that'll be that's new and very useful. We talk a lot about statistics. We know that our state faces lots of challenges. As far as health rankings, physical and mental health. We're usually at the bottom of the list as far as health outcomes. This region of the state is usually about in the middle. Is when we rank parishes against each other. But we know that we have challenges. But Betsy, who's going to introduce herself in a second, I think has some useful information to maybe help us figure out what to do. How can we move past some of the challenges that we have to improve physical and mental health for all of our residents.
I'm Betsy Wilkes. I'm glad Tina showed up, and I did have to apologize for not being Dr. Tina Stefanski, who we all know and love. My connection is that I am working on a state grant management team for Project Launch. What that does is try and get behavioral health services to 0 to 8 kids in 3 different areas, in home visiting, in daycare centers, and in primary care. One of the other things I do is another federal grant that is SFIR, which is Screening for Substance Abuse, Brief Intervention, and Referral to Treatment. And I'm also an ACE educator for the state of Louisiana, and I'm going to talk to you a little bit about how those things, there's some pilot projects going on in this area that are really innovative and interesting, and hopefully we can make very successful and spread around to the rest of the state. So I'll have an opportunity to share some of that with you.
Great. What a distinguished panel. Let's give them a hand. All right, we're going to start with Gary. And our question for you, Gary, is that there's really a growing body of evidence that where you live, not just how you live, may directly impact your health. For example, a recent study in Health Affairs found that poverty within neighborhoods can contribute to decreased health outcomes. So what specific health challenges do families living in high poverty neighborhoods face? And how can we leverage existing resources to provide health solutions for all?
Okay, thank you. I was totally prepared to talk about mental health, so I'll go ahead and talk about housing in neighborhoods. Obviously, a poor neighborhood is vulnerable to addiction and crime. And how do I know this? I know this because I worked for 5 years in a prison being mental health director. 75% of the offenders were low income and nonviolent offenders. So I learned a lot about what it is growing up in a poor neighborhood where the housing isn't good, the schools are not good, you don't have the support system. Jennifer will probably talk about the lack of access to good, nutritious food. So yeah, a poor neighborhood affects your mental health. You're living with income insecurity, housing insecurity, food insecurity, healthcare insecurity, transportation insecurity, and education insecurity. So how are you supposed to figure out how you contribute to society if your whole focus is survival? Those are all policy issues, and I hesitate to get into policy, but in my opinion, and at this stage of my life, I'm beginning to see that it's all about policy. The LUS report, many of you may know about LUS already. Those are the working poor. They are paying for housing, but they're paying too much, and they're paying for substandard housing. So what is that supposed to do for your mental health? You're living in a poor neighborhood, and the only thing you see is people making some quick money using drugs or selling drugs. Again, that's from my experience in prison. What else? Chemical dependency. Now, the LUS report indicated, I think it was the LUS report, indicated that when you move up, when you've improved your education, you move up into a different neighborhood and the stresses are even worse than they were in the neighborhood you were in. Interesting, counterintuitive, but apparently the data is showing that. So even moving out of poverty causes some form of mental illness. So what do? We focus on poverty. We focus on public policy is what we focus on. The first thing we need to do is we need to enlarge all of our food programs. We need to get together and make Washington enlarge SNAP. They need more food supports. All school lunches across the country should be free. Breakfast should be free. And then the summer programs need to be expanded. So this topic is so huge and complex that you just can't get on all of it. But I appreciate your attention, and I'm ready to move on.
Okay, thank you, Gary.
All right.
Gary brought up the issue of food, and we know food security is a huge issue for people. But Dr. Jackson, if you don't mind, with your background, let's talk a little bit about food deserts and the problems that creates. Food deserts are defined as geographic areas that are lacking fresh fruit, vegetables, and other healthy foods that people need. And those food options, and they're usually not found in impoverished areas. And this is really largely due to a lack of grocery stores, farmers markets, healthy food providers. So such food deserts certainly exist here in Acadiana. So where are these food deserts, and how can we make a difference with them?
We know that a lot of the food deserts are on the north side of town. I live off of Simcoe. There's a convenience store located around Pinhook and Simcoe. And I remember one day I ran out of potatoes, and we went up to the store, and as you would expect, there were no potatoes. Now they had boxed mashed potatoes, but there were no actual fresh raw potatoes to be able to make my mashed potatoes that I was trying to do. When you think of a lot of the convenience stores that are in the low-income area, a lot of times, and we know, they don't have fresh fruits and vegetables. There's a few things regarding that. I used to think that education was the key. If we would just educate people and say, oh, you need to buy fresh fruits and vegetables, they'd do it. I've also heard people say, people on food stamps, look at their shopping carts. Look at the food that they're buying. Well, you know what I started saying? Look at the middle income and upper income people's grocery carts and look at what they're buying. So I used to think it was just education. We all know to buy fresh fruits and vegetables, lean meats and things like that. How do we get our low-income poverty group to actually do it? It goes beyond education. It's that access and its availability. Now, if you look around the north side, we have our share of Dollar Generals and Family Dollars. Someone had mentioned, what about putting fresh fruits and vegetables in there? And it's one of the stores I love to shop. I'm not even complaining. I love going to Family Dollar and Dollar General. But there are no fresh fruits and vegetables at these locations. So someone said, what about if we did that? So I thought, man, that would be the key. In fact, I'm working with Junior League of Lafayette, and they're going to be doing some research on looking at childhood hunger. And that was one of the suggestions mentioned. So I said, okay, if we did this, what are the chances of low-income people in poverty purchasing these items? Then I started thinking, it's more than that. Let's put ourselves in the position of a single mom, maybe working 2 jobs, coming home, kids. I see hands going up. You're tired. So I understand why you're going to make the boxed macaroni and cheese. It's quick and convenient. So what I've been saying to my clients is, still buy the boxed macaroni and cheese. Don't use the powdered cheese. Use actual real cheese and milk to make your macaroni and cheese. So my suggestions go beyond, let's just educate on this. No, we need to give some practical things. When you're making the mashed potatoes, the boxed mashed potatoes, because of the pricing, it's cheap and things like that, instead of using water for the mashed potatoes, y'all know the answer. What should you do? Exactly. So those are my suggestions. One last thing I wanted to bring up too. I think about Kevin Gidry's, right there on Wall Street, Rosemart, Super One, a lot of the grocery stores that we do have on the north side. What if we were to get with these grocery stores and ask them if they could give us some of their discounted fruits and vegetables? Maybe we did food trucks. You know in the summer how the ice cream trucks always coming around? What if we actually had food trucks that were going around the neighborhood? Because we know the issue is cars. It's availability of getting to these places. And when you do get to the grocery store, you have to think about how many bags can you carry back on the bus, walking back to your house. So if we did food trucks offering these fresh fruits and vegetables, that would also help.
Thanks, Jennifer. What she's saying is that it's not just education, it's about changing behaviors, changing mindsets, but also making it available. And so that's something that, again, it sounds like, to your point, it's policy, right? It's about getting people to change the way they do things. All right, we're going to pivot to the next question, and Betsy and Tina are going to share that question. And that is about making, I think, tough choices every day for people in poverty can be a constant stress. And I think that's one of the things that Gary talked about. And that living in poverty has very important implications for mental health. In fact, research suggests that the lower individual socioeconomic status is, the higher is the risk of mental illness. What specific mental health challenges does the ALICE population in Acadiana experience, and how can we collectively navigate these challenges? And again, ALICE is an acronym that really spells out asset limited, income constrained, and employed. It's another name for the working poor.
All right. I think I want to start with using the example of, I think the questions that we had today really reflect how we tend to think about healthcare, food access, and mental health care as kind of separate entities, right? Because there's usually separate offices you have to go to. There's separate places where you see a physician, or maybe you're referred to a therapist. And I'd really like to challenge that thinking for you, and I think that that's something that's beginning to happen across the country, and fortunately, there is a pilot project in Lafayette, Vermilion, and Acadia Parish that is really challenging that thinking. The way that we used to do that was really in these silos that folks have a lot of trouble getting back and forth between and negotiating all of that. And the reality that our mental health and our health and our nutrition are somehow separate is really a fallacy, right? I mean, if you have diabetes and you're depressed and you don't have access to good food, all of those things are interrelated. And somehow trying to pretend that one's going to get fixed at one office and another down across town at a different office is really not useful. It hasn't worked for us in the past. We can no longer fund that. And so what we're doing now is really working hard towards integrated care. And integrated care means taking care of that whole person. And that whole person means your health, your mental health, your nutrition, your environment, all of those things that are going to impact your health outcomes, your mental health outcomes. Project Louisiana is set in Lafayette, Vermilion, and Acadia, and our local coordinator is with us today. Sabrina Domingue is here. If you want any information about Project Launch, feel free to be in touch with Sabrina. It is accessing behavioral health services in the places where we find kids. What we know from lots of data is that the biggest bang for your buck in mental health is addressing young children, right? It's preventative care. It is making sure that we're looking at things really early on and that we're taking care of the youngest amongst us, and that we're preventing later health and mental health problems by addressing them really early on. And when you address things with young children, you're clearly addressing young children and families. They don't operate in a vacuum. So all of the issues that those parents and families have are going to be affecting those children. We have mental health consultants in home visiting. We're doing that with early steps to increase capacity of the folks in early steps that are helping families and children that qualify for early steps home visiting programs. We also have mental health consultants that are going into all kinds of child care settings. We're going into agencies, we're going into home care settings to begin to teach some of the directors and educators and folks that are at those settings how to manage some of the behavioral problems. Also, how to screen and appropriately find mental health issues that are surfacing really early on and not waiting until children are in school and having problems that are 6, 7, 8 years old. The earlier you can address those things, the better the outcomes, the fewer problems for the child and the family. We also have a mental health consultant that is working in the primary care settings. Because where do you go when something's going wrong with your child? You go to the doctor, right? You go and ask. So we're in family medicine, we're in pediatrics, and we're also in obstetricians' offices. Because childhood starts while you have a mom growing a healthy baby. And those are really important to address in all of those areas to begin to teach, because our primary health care really has become the de facto mental health care setting. We don't have enough dollars in the state to treat people that don't have really extreme mental illnesses in our public settings anymore right now. And that is very unfortunate, but it's what we're working with. And so what you do is then in turn train and put trained mental health professionals in settings so that you can catch things early. And I think a good example of that would be, so say you're pre-diabetic and you start having elevated sugars and those kinds of problems. Well, your physician wouldn't ignore that and not talk about that until you're diabetic, right? I mean, that makes no sense at all. Certainly, it would start very early on. Maybe there's some mild depression. Maybe there's some anxiety. There are great first-line behavioral treatments that can access those and improve those remarkably before you ever get to a point where you need more intensive treatment. So it's very important to catch those things early on, to begin to think about health care, mental health care, all of that as an integrated service. And one of the things that directly relates to that is something that is called ACEs and the ACE research. Has anybody ever heard of ACEs? It's adverse childhood experiences. Anybody in the room know about it? One? Okay, this is pretty clear. This is a really good example of what I find when the ACE educators travel around the state, is that folks don't know about it yet. This is really important public health information, research that started over 20 years ago and is still ongoing. It is put together by Kaiser Permanente in California, which is arguably some of the best health care in the country, and the CDC. This is about how adverse childhood experiences, things that happen to you as a child, have very long-term consequences in your life, not only socially, emotionally, but in health outcomes. And now there's fabulous data that supports this, that we actually have changes in our body, in the structures of the cells, and in our brain that are directly related to the amount of adverse childhood experiences that we have. And they're extremely common. They happen in all socioeconomic classes. As you might imagine, there are more of them in poverty level classes, but they happen across the board. And the reason it's really important is because knowing about adverse childhood experiences, screening for those things early on, can inform the way that we build resiliency in schools, in healthcare, in the way that we think about treating children and working with poverty in this community and in all communities. So I would like to end by saying that we are fortunately very high on the list, which doesn't happen very often for Louisiana, and that is in having a panel of people that can do education about ACE research, and it's the ACE educators. It's put together by a joint effort of the Office of Public Health and the Office of Behavioral Health. We have educators across the state. We have educators in this area who can come to a school, your agency, your group, anywhere to begin to do the process of educating about what, in fact, are adverse childhood experiences, how do you build in resiliency, and how do you begin to heal the children that have had those experiences, the families that have had them, and to build in protective factors so that we reduce those numbers in the future.
Well, thank you,
Thank
Betsy.
you.
Thank you. I know we're probably out of time. I just wanted to take a couple more seconds. You know, we all know how physical health, there's been a lot of emphasis on physical health and diabetes, chronic diseases, cancer, heart disease. But I don't think there's been much recognition on the mental health and its effect on physical health. So thanks, for y'all's support of our health units, and I'll have to give a shout out to Mr. Boudreaux, who's on your agenda later. Under his leadership in Lafayette, and it's kind of trickled down to other parents in this region. We've got greater support of our health units, and we've been able to work with our state offices to really expand, beyond looking at physical health, purely through our health units and with our partners. We're actually now able to have grants like Project Launch and really help the community understand and give education and information to all of you. So you will be seeing a media campaign over the next hopefully by August, early fall, really directed to parents. What to look out for their children. What are some flags, some red flags that you need to be aware of your children when they may have difficulties. Children who are affected by these adverse childhood experiences, and what can parents do before you even get to the doctor to try to help your child deal with their feelings, understand, how their feelings, for parents to understand how to again help those children better deal with some of the emotional things that they may be experiencing through all of these, at home, at school. So be on the lookout for that. Project Launch has a room working with, it's actually the Amazon Corporation's got a great educational program for families, and so we're going to be rolling that out here. And then also know that Medicaid expansion over the next couple of weeks, so we'll be back here next week to talk about that, and hopefully that will give more people in this region and in this state access to physical and mental health care to expand the application. So we want to be the region in the state that is really signs up that anyone who's eligible, we want them to have access to that. So we're going to be needing you all's help to reach out to those you interact with to make sure that everyone
has that information. So again, we'll be meeting here next week and hopefully more information on that to come in the next couple of weeks. So thanks for your comment.
Well, and thanks to our panelists. Honestly, a lot of knowledge here. We could probably spend a day talking about health. In fact, I think we could spend a day on all these topics. So maybe that's what we'll have to do next year when you plan on this program again, when Smile puts this program on again. But really interesting. I think when you look at poverty, we know that education is important, but yet when you look at health, it can be the lack of good health or mental health issues can really be a barrier to education or any kind of forward progress that a person wants to make in their life. So I want to thank you guys again for sharing your wisdom with us and your insights. Lots of things that I want to learn more about, the things that you brought up in this conversation. So thank you very much for being here.